Good morning, sir. Today I wanted to ask you some questions regarding rheumatology. How this rheumatology branch differs from other branches of medicines, and also what are the most autoimmune diseases and rheumatology diseases that you treat in our day-to-day practice.
Yeah, so the rheumatology is a branch of medicine only, which is advanced branch of medicine. As there's cardiology, neurology, gastroenterology, they deal with particular organs in the body. The rheumatology is not a single organ branch. It may affect your any organs in the body because it's an autoimmune disease, autoimmune branch in which the diseases includes like lupus, rheumatoid arthritis, vasculitis, and etc. Because in this case, in rheumatology, usually we see the connective tissue disorders that includes your blood vessels, tissues, bone, joints, all the connective tissue, and they may affect with the diseases which includes in the rheumatology. So it is not a different from medicine. It is just an advanced version of the medicine. So being a rheumatologist, it's very challenging to treat these autoimmune diseases such as rheumatoid arthritis, in which patients complaints of early morning stiffness and joint pain, inflammation, swelling. Second most common is lupus nephritis. So it may start with the skin disease, hair loss, and other things. Then third most common is scleroderma, in which we get skin tightening and lung involvement eventually. Then vasculitis and other joint related symptoms like gouty arthritis, post viral arthritis. These are all the inflammatory diseases we deals with regularly.
So, what are the early signs and symptoms that patients should watch about these autoimmune diseases? And secondly, what are the consequences of delaying these signs and symptoms to be noted?
Okay, so any autoimmune disease may present with extreme fatigue, tiredness, and maybe presented with joint pain, sometimes hair loss, dryness of mouth, dryness of eyes, skin sensitivity to the sunlight. These are the some subtle changes in the behavior and the symptoms of the patients in which we should intervene with the rheumatological knowledge. So any disease which is detected early can be treated better ways. So like any inflammatory arthritis or any autoimmune disease, if detected early, we can intervene early and we can check the disease activity. If the disease is not very active, we can start treatment, the basic treatment whatever is needed for the particular disease, we can start that. And if the disease diagnosis is delayed, in that case sometimes patient may present with the lupus patient present with the kidney involvement, scleroderma patients present with the lung involvement. The delayed is the diagnosis, there is difficulty in the treatment also.
So, there are many autoimmune diseases which are chronic in nature. How do you help the patient to cope up with such kind of diseases? And secondly, sir, my question was also that what are the lifestyle changes a patient should do to cope up with the arthritis, rheumatic arthritis, and lupus diseases? Any suggestions about it?
So these diseases most of the times get ignored in the society because the symptoms are very vague. In that case, the diagnosis gets delayed, and once the diagnosis gets delayed, the patient's disease goes up and up, the activity goes up and up. There are some irreversible damages to the joints and the tissue in the body. And again, because of everything, patient's mental stress get disturbed and patient may feel more sick, and the disease worsen and worsen. Definitely, lifestyle modification and dietary modification are the basic pillars of the treatment. So I always tell to the patient, the medicine helps like 30 to 33%, lifestyle modification again 30 to 33%, and your dietary habits and also your exercises. The all in all, the 3-4 parameters are the basic pillars of the
The
treatment
most
of
common
any
treatment
any
options
rheumatological
available for
illnesses.
the autoimmune diseases.
So autoimmune diseases, first thing is to diagnose the disease, and once we are sure about the disease, so there are some disease modifying agents, so which can halt the progression of the disease, which can treat the cause of the disease. So disease modifying agents, usually we call them as DMARDs, and some are the immunomodulators. And in advance, nowadays we have many advanced technologies. In that case, we can use biological agents also if patients tolerate it well.
Are there any promising therapies breakout in the field of rheumatology that you are excited about?
Yeah, as I told you, this is a newborn branch of the medicine. So every day there are upcoming drugs are coming out, upcoming diseases are diagnosing, upcoming tests are there to diagnose the disease properly. So there are, as I mentioned earlier, the biological agents which reduces the inflammation in the joints and tissue, which can be the next, we can say, next level of treatment for the in future.
How do you approach personalized treatment for the patient considering the vast spectrum of the autoimmune disorders?
Yeah, so every individual is different, and we have to personalize the treatment for each and every individual, each and every patient. So when patient comes to us, we have to check his all the basic parameters, and we have to consider the which drug is safe for the patient. And initially, a lot of patients don't tolerate these immunomodulators, immunosuppressants. Then we have to titrate the dose, either up titrate or down titrate the dose of the medication, or many a times we need to change the medication to the safer options also.
Okay, sir. Can you also explain me diseases like vasculitis, scleroderma, fibromyalgia, and what makes them challenging to treat it?
Vasculitis and scleroderma and fibromyalgia. So vasculitis is basically there are we have all small vessels, medium vessel and large vessel vasculitis. They presented like vague features again. We may get headache, chronic headache. We may get blood in the sputum. We may get rashes over the skin. So this vasculitis can present with anything, and the diagnosis of vasculitis is very important. As we know, the vasculitis is a dangerous disorder. Uh, it may causes permanent disability to the patient. So diagnosing and treating vasculitis is very important. Secondly, scleroderma. In scleroderma, initially patients gets skin tightening, then eventually it is limited or systemic scleroderma we have. So limited is having just skin involvement, and in systemic case we can get the lung involvement also. But with the treatment we can again halt the progression of the disease. We cannot take it out from your body because it's an autoimmune disease, so we cannot take out your immunity from your body. And lastly, fibromyalgia. In this case, usually fibromyalgia we don't get any reports positive, like RA factor, anti-CCP, ANA, everything comes negative, and other factors like uric acid and HLA-B27, all autoimmune markers comes negative. In that case, it is the diagnosis of exclusion. Fibromyalgia is diagnosis of exclusion. In that case, a lot of counseling is needed. Sometimes it may need. Yeah, just the Sjogren syndrome is one of the chronic inflammatory autoimmune disease. In that case, we have some glandular and extraglandular manifestation. In glandular manifestation, patient's tear formation goes down as it affects your lacrimal glands. Patient's saliva formation goes down. Patient feels thirsty. Tongue becomes dry. Eyes becomes dry. And then eventually, extraglandular manifestation may include neuropathy, joint pain, other symptoms also. Again, as it is autoimmune disease, we can control the activity of the disease, and patient can live a
So,
normal
what
life.
are the most challenging thing about treating or managing such conditions about gout and lupus?
Gout and lupus, right? So gout is basically hyperuricemia. In that case, uric acid crystals get deposited in the joints, and joint capsule gets distorted, and patient may get acute gouty attacks. In that case, patients get redness, warmth and tenderness, and a lot of pain at the joint sides. In that case, we need to give some short course of steroids and some anti-inflammatory agents which can control the acute flare of the disease, and we can maintain the uric acid level by giving some anti-uric acid medications. And the lupus, you ask about the lupus also. So lupus is basically a systemic autoimmune disease in which patients, as I told you, patients may get hair loss, oral ulcers, photosensitivity, then less production of the blood cells, like anemia or thrombocytopenia. Patients may get skin rashes, uh, butterfly rashes, and eventually patient may land up into the renal involvement also, for which we call as lupus nephritis. But on timely diagnosis and treatment, we can control the progression of the disease.
Okay, sir. So, can you also share some memorable case that you have seen in your practice that in which you have made an early diagnosis intervention and it made a significant difference in patient's life or his improvement?
One is lupus vasculitis. In that case, patient had a blackening of the toes because patient was untreated and misdiagnosed earlier. So when patient come to us, the patient had blackening of the toes and almost they are in the digangrenous form. So we intervene, we diagnose the case, and it comes out to be a lupus nephritis. Patient eventually land up into the amputation of the toes, but we save the other involvement of the joints and other tissues also.
Okay, sir. You have also specialized in critical care. How often do rheumatologists require critical care intervention, and what are the scenarios that where it is was necessary for you?
Sometimes we get the flare in the disease, means when the autoimmune disease is not under control, sometimes because of the patient's non-compliance or some medicine are not helping to the patient, so disease gets flared up. So in case of some rheumatoid arthritis also, when it gets flared up, patients may need a critical care management. In case of lupus nephritis, in that case patient's kidneys are at risk, so we have to get the ICU setup ready for the patients. In some cases, RA may involves lungs, lupus may involves lungs, scleroderma may involves lungs. In that case, if patient is having some life-threatening scenario, in that case we need a ICU backup.
How do you balance treating systemic diseases and diabetes, hypertension in the patient with autoimmune diseases?
Yeah, it is very difficult task to balance both the systems, as autoimmune or the inflammatory conditions requires supplementary dose or the low dose of steroid for short period of time. In that case, sugars may flare up, BP may goes up. So we have to advise the patient to monitor sugars and blood pressure regular interval, and make them understand it might be possible that your sugars and BP may fluctuate. In that case, we may need to step up the treatment for the same also.
How important it is the collaboration between rheumatologist and other specialists like orthosurgeon, neurosurgeon, and endocrinologist in managing autoimmune diseases.
Yeah, not only orthopedic, neuro, or endocrine system involves. We may need assistance from the ophthalmologist. We may need assistance from the pulmonologist. We may need assistance from the dermatologist. So it's all in all. We have to have work together to treat the patient and for the better results.
How do you coordinate care of the patient with complex multi-system diseases?
Yeah, in case of multi-system diseases, we have to involve the particular specialist also. Along with that specialist, we have to discuss the few things of the patient's disease and reports of the patients, and accordingly we consider the treatment for the same.
Sir, in your experience, what are the most common thing that common people should know about all this autoimmune diseases and rheumatology?
Yeah, so I feel every doctor should know about the rheumatological illnesses. Those who are working at the ground level, everybody should know at least basics of the rheumatologist, and when to refer, where to refer, they should know, because patient the any patient basically goes to the family physician. So awareness about the autoimmune disease and the rheumatological illness in the family physician is also very important, because early detection and diagnosis of the patient can save the life of the patient.
What role does patient education helps you in preventing the flare up and managing the progress of the autoimmune diseases?
Yeah, the flare-ups is very common. As I told you, if patient is non-compliant to treatment or some treatment is incompatible to treat the disease, then we have to consider the other options. And if patient is non-compliant, then we have to make them understand what is the importance of the medication, and what kind of problems they can face in the future. We have to make them understand, and then only we can control the disease activity and treat the patient properly.
Sir, did you see any increase in autoimmune diseases after this COVID 19 scenario? And if so, could you explain why?
Yeah, the COVID-19 was the pandemic in started in 2019 up to 2020 and last up to 2021 December. So after that, I noticed there are a lot of autoimmune conditions comes out. Patients are getting vague symptoms, and a lot of thrombotic activity was increased. patients may presented with the vasculitis, many a time stroke and heart attack, and young individuals are getting it. So I feel after COVID attack, the patient's immunity got disturbed, and because of the disturbed immunity and the inflammation in the body, these things are happening.
Sir, what are the long-term effects of infection like this COVID-19 and other viruses on the patient pre-existing autoimmune diseases?
So I also see one thing: those who was having lupus or rheumatoid arthritis or any autoimmune condition, who were taking hydroxychloroquine for a longer time, they affected less with this COVID-19 viral infection. And I feel because of the COVID-19, patients' immunity may got disturbed, but the autoimmune conditions which were there in the patient, which didn't flared up.
Sir, a bit of a personal question. What inspired you to be a rheumatologist and focus on autoimmune diseases?
Yeah, the rheumatology was a dream branch for me after my MD medicines. During my MD, means my post graduation periods, we saw a lot of people suffering. A lot of people were untreated, undiagnosed, misdiagnosed, or mistreated also. So I felt something about it, and I feel uh, I have something to give to return to the society. So I choose this field to treat the undiagnosed or untreated patients.
So, what are the most rewarding aspect of being a rheumatologist?
Being a rheumatologist, we have to be patient enough to hear all the complaints of the patients. Sometimes it never ending complaints from the patient side, and being patient, I am evolving myself. I'm a good listener. I listen every single complaints from the patients, and I think it is becoming day by day. I am becoming better in my treatment aspects also, and patient's care also.
So, would you like to inspire the upcoming rheumatologist that future holds? And are there any trends and technique that you believe will transform this field in upcoming years?
So, rheumatology, as I told you, it's a newborn child of the medicine, and it's evolving day by day. Every day we are getting new researches. Every day we are getting new symptoms of the same diseases. Every day we are getting new drugs for the medicines. Nowadays, there are most prospering molecules are biological agents. They are like they're going into our systems. They are making less production of the inflammatory markers, and becoming this is becoming better and better. Also there is some threats also, as these medicines are dealing with your immunity, then our immunity may goes down. We may get super added infections like fungal infection, other bacterial infections. So we have to check the balance of the patient's immune system, and then only go ahead with the advanced treatment to the patient. Thank you so much for listening to this.
Okay, sir.
If
Thank you so much for this
anybody
interview.
has any problem regarding their connective tissue like joint pain, swelling, I think you should evaluate them early and refer to the rheumatologist. Thank you so much.